Hello there. Welcome to the cranial nerve exam today. Are you here for the 3-hour cranial nerve exam here at Dream City Clinic? Okay. And could I just quickly sign you on in before I send you to the clinicians? Okay. You're here for the full 3 hours, correct? Is this your first time having a cranial nerve exam, or are you a master at it at this point? Great. And do you wear glasses or contacts currently? Okay, and let's just quickly take some vitals. Let's first check your eyes. Can you look at that light for me right there? But don't look at my fingers. Good. Good. Great. Other side now. Can you look at that light right there? Good. Great. I'm going to point the light right at your face, and I want you to let me know if the light's getting closer or if the light's getting farther away. Here's the starting point. Is it getting closer or farther away? Good. Closer. Once more. Keep looking. Good. Farther away. Once more. Farther away. Good job. Now, what I want you to do is, do you have any color partialness in your eyes? Perhaps you're someone who is unable to see certain colors. Okay, I'm going to pull up some pens here and just let me know the first thing you see. What color is it? What color is this one? 3, 2, 1. That's green. Did you get that correct? That's okay. Once more. What color is this one? 3, 2, 1. Orange. Good. Next one. What color is this one? 3, 2, 1. Pink. Did you get that? 2 more to go. What color is this one? 3, 2, and 1. This one's purple. Did you get that? Okay. And on to the last one. What color is this one? 3, 2, and 1. This one is pink. Good job. Okay, let's just finish signing you on in, and I'll send you over to our first clinician. Enjoy the 3 hours of cranial nerve exams, and have a great rest of your night. Bye. Okay, nurse, can you send them on into the first doctor's appointment? Yes, for the 3 hours long of cranial nerve exams. Okay, have fun now. Bye. Okay. It looks like we have a patient arriving for the most detailed cranial nerve exam ever. Perfect timing. I will have the nurse send them on in. Extra detailed. Okay. Good. Oh. Hello there. And welcome to Dream City Clinic. I am Dr. Brain. And just for clarifications, are you here for the most detailed cranial nerve exam ever? Good. You are in the right place. Please make yourself as comfortable as possible and just sit right there on the most cozy doctor's bed. That's also an exam chair, but we can move it around. Okay. Make yourself comfortable and just sit and or lay down right in front of me, okay? Good. I am the doctor. It is a pleasure to meet you today. I'm just going to sanitize my hands first. Are you comfortable with me being your primary care physician today? If not, we can always exchange for another doctor, physician, what have you. You're okay with me being your doctor today? Okay. If that changes at any point, let me know and we can switch out doctors, okay? Good. So, just to double check, you're here getting the very detailed cranial nerve exam because you've been having some pretty bad time sleeping recently, correct? That's okay. Yes. Any information that gets shared today is only between me, you, and my computer, okay? Yes. You only are able to access the files, etc. So, if there's any information you don't want to tell me, you don't have to, no pressure, okay? Good. Now, let's start with a couple of questions first. This is going to be a super detailed exam, okay? Have you ever had a cranial nerve exam before? And it said, perhaps here on your chart, could I just double check with your first and last name? Good. It's a beautiful name. And how do you spell your last name? Gorgeous family name. And then here, could I please double check with your birthday? And goodness, does that make you a Capricorn or does that make you an Aries? I knew it. And are you currently having difficulties falling asleep? It says on my chart that the nurse that saw you before wrote that you're here for such a detailed exam to see if maybe you twisted or perhaps you fell off of your bed, which happens more than you think, or what have you. Okay. And just another quick question. Do you have any allergies to any medicines or food? Okay. Thank you for letting me know. So, my hands are sanitized. I'm just gonna quickly get some gloves on, okay? And we're gonna begin the exam. Now, this is going to be an hour long, if not more. Is that okay with you? Some find this to be super relaxing, so if you find yourself falling asleep, that's okay. We're gonna keep you here for a sleep study too. Now, we test the cranial nerves just to see if everything's working right. So, first we're gonna just take your vitals, okay? Good. And may I touch your face? If not, that's okay too. Okay. I'm gonna just put my hands right here next to the sides of your cheeks, okay? Okay. And now, next to your eyes, okay? I'm just gonna take a quick look where your eyes are a bit of pressure. Just keep your eyes closed for now. I'm just gonna put a little bit of pressure with my hands. Good. I'm now just gonna feel right there where your lymph nodes are, okay? Okay, and it looks like everything feels good there, okay? Good. And now I'm just gonna feel around your head and your ears. Again, if you've just been having trouble sleeping, we can figure that out with this very detailed exam. Good, so I'm just gonna feel right around your scalp and your ears. Okay. And could you feel that? Good. I'm gonna quickly check your eyes. Just gonna ask you to look at my nose right there, please. Good. Just keep looking at my nose. diagnosis with nystagmus at all? Okay, and do you happen to have any diagnosis by you wearing any contacts or glasses? That's okay too. Look at my nose again, okay? Look at my nose. Bright light warning. Look at my nose. Good, 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 good. And look at my nose. Bright light from above. Look at my nose. Good. And bright light from below. Just look at my nose. Good. Look at my nose. Good. Look at my nose. Great. Good job. I'm gonna get even up close now. It might sound like I'm mumbling to myself. I'm just gonna look carefully at your eyes, okay? Just look where my fingers are wiggling right there, okay? So looking at the eyes, it looks like the pupils are reacting well to the light. That's perfect. But if we go over there to this direction, that looks good too. Look where my fingers are wiggling. We're just gonna take a quick look at what the light is just shining carefully. It looks like the eyes are reacting super well to the bright light. Very good. And right there. And when we look from below, it looks like the eyes are absolutely tired and just a bit irritated with brightness and perhaps a little bit of redness. Okay, very good. You can relax now. No worries. So, your eyes do appear to be pretty tired. Have you had any difficulty falling asleep? Has it taken you a long time to sleep? How long do you typically sleep? Okay. And when was the last time you had a completely full night's rest? Okay, it's been quite a while then. That's okay, I am just writing it down. I'm just gonna continue taking your vitals. Next, I'm just gonna get your temperature, okay? We're gonna test it twice and you'll hear a beep. Good. So just relax. I'm gonna put this on your forehead, okay? And you're just gonna hear a beep. Good. Good. And the temperature is good. I always double check. Again, just right on the forehead and perfect. Your temperature is normal. Have you had any feelings of cold or flu within the past 2 weeks? Okay. Any feeling of chills or sweats? Okay. And have you had any differences with your vision? Perhaps all of a sudden you can't see too well too far away, or perhaps all of a sudden you can't see too well up close. Any difference with that within the past 2 weeks? Okay, let me know if you do at all, okay? Good. I'm just gonna get your heartbeat now, okay? And it's gonna just feel a little cold. I'm so sorry for that, but it always does that. And may I place that right there on your shoulder? Good. And just relax. And breathe in, please. And breathe out. Good. And please breathe in. And then please breathe out. Good. And just relax. Other side. Good, right there. Please breathe in and then breathe out. Breathe in and then just carefully breathe out. Once more, breathe in and then breathe out. Good. I'm going to place this on your back now because we're just hearing the lungs. So, just carefully right there. Please breathe your stress levels been, by the way? Has work, school, or life just been keeping you up recently? Again, it's okay not to answer if you don't want to. I'm only opening this up as a questionnaire to see how I can best help you, okay? Your health is our #1 priority, and I don't want it to feel like we're ignoring any of your issues, okay? Okay, I'm glad you're here with us today. So, any issues with that? It's okay. Good. We're gonna move on now to the first test for your cranial nerves, okay? Good. We're gonna be testing optical, orbital, visual, everything, okay? If the lights are too bright, let me know. Or close your eyes. Both are absolutely okay with me. We're gonna be very precise and detailed with this. Good. So, I'm gonna bring my little pen light back first. And what I want you to do is, can you keep your eye on the little seahorse right there? Just look at the seahorse. Good. Just keep looking at it. So, I'm just seeing visual signs of eye tiredness and no signs of the actual weakness to restrain the eyes. Perhaps we're just looking at the visual field priority test for this, which would be perfect. Keep your eye on the little seahorse. Good job. And from above, it just looks like the eyes have the perfect amount of brightness and shine, which is perfect for what we're going to be talking about today, which is absolutely great. And keep your eye on the seahorse. And looking just around the perimeter of the eyes just look to be a little bit tired, less likely to be a cause of something. Okay, look back at me. Good. And look at my glove right there. Okay, back to the priority of the eyes. It looks to be very good. Okay, good. And relax. Now, I'm gonna ask you to do something. It may seem a bit silly. Follow the light, this one, with just your eyes, okay? I'm gonna be holding the side of your chin right there to make sure you don't move your neck back and forth like that. Just use your eyes to follow the light, okay? Again, if it's too bright, let me know, or just close your eyes, okay? Good. I'm looking for tracking is what it's called, and to make sure the vestibular part of your eyes, the orbital, and all the cranial nerves that function with your brain to your eyes are proper, okay? Good. So, I'm gonna put my hand right there, and just follow the light with your eyes, okay? Good. Just carefully trace the light with your eyes. Keep your head still. Good. Trace the light just with your eyes. Good. Great job. Trace the light. Good. Just trace the light with your eyes. Good. And above. And just carefully follow the light as best as you can. Good, good, good. And back to the center. Again, if you do need to close your eyes, it's okay. I want you to feel the absolute most comfortable you possibly can be. Good. I'm going to put it a little bit closer now. And this is an exercise to tire your eyes out. We're seeing how they perform, especially with tracking, okay? So, a bit closer now. Again, I might be mumbling to myself. Just follow the light, okay? So just with the best of your ability, please try your best and just follow the light, okay? And just follow the light with just the best of your ability. It seems that you're able to easily do that. Good. So it looks like the eye is tracking the light very well. We're not seeing any differences between left or right. Left or right seem to be good. I'm not you to relax from the bright light being in your eyes, okay? So, when I close my hand, I just want you to blink, okay? So, relax your eyes, no stress, there's no stress here. Just blink when I tell you to, okay? Good. So, when I tell you, I want you to blink and open and blink and open and blink and open and blink, open and blink, open and blink, open, and now blink and hold your eyes closed for 5 seconds. 5, 4, 3, 2, 1, and open. Very good. Are you doing okay? Good. So, your eyes are tracking light super well. Let's continue testing, okay? So, I'm going to give you 2 different types of lights. One of the lights happens to be pink, and one of them happens to be yellow, or green, some say. I want you to let me know which light you see shine in front of your eyes first. The green or yellow light, or the pink light. Are you ready? Just let me know which one you see flash in front of your eyes first. This one is the pink light, and this one is the yellow light. Let's begin. Pink or yellow? Good. Yellow. Pink or yellow? Pink. Good. Relax. Okay. Pink or yellow? Good. Yellow. Pink or yellow? Good. Yellow. And pink or yellow? Pink. Very good. A bit closer now. Okay. Which one do you see first? Pink or yellow? The pink one. Good. Pink or yellow? The yellow one. Good. Pink or yellow? Pink. Good. And pink or yellow? Good. Pink. Okay. The reason why I use different types of lights and distances is to see if you're able to focus on each individual one. This also will tire your eyes, okay? I'm proud of you for doing that. So, I'm now just going to individually check the left and the right eye. I'll be covering one of each. All I ask you to do when I do cover one of your eyes is follow the light that I will shine in your eye. I have a very nice otoscope, and I'm just gonna make some clicking sounds, take some photos of your eyes, okay? Just follow the light. Good. I'm gonna cover one of your eyes now, okay? And let me know when you see the light. Do you see the light? Good. And I'm gonna take some photos. Look at the light. 3, 2, 1. Good. And one more. 3, 2, 1. Good. Keep looking at the light and below right there. Good. And look from above. Good. Keep looking at the light and right at the center. Okay. Good. Okay. And let me know when you no longer see the light with this eye. Good. And let me know when you see the light with that eye. Good. Now where do you see the light disappear once more? When do you no longer see it? Good. And show me when you see the light. tiredness, and the way that we can tell tired eyes is a lot of slow blinking. Now, I'm going to test you with two types of charts. You actually see it behind me now. And I'm going to test you with the card that's going to be a little bit closer than this one is right there, okay? I am going to point at the letter. And all I want you to do is tell me what letter you see. Again, no answers are correct or wrong because your vision could be different in comparison to other people. I'm just trying to see and describe your cranial nerves with this exam, okay? Good. I'm going to start with the first letter here, the one at the very top. So, do you think you can tell me what letter that is right there? Let me know in 3, 2, and 1. What is that? E. Very good. Could you tell that that was E? Okay. Let's move on to line number 2. Okay. Line 2. What letter is that one right there that I'm highlighting and circling over? Right there below the E. What letter is that? Let me know in 3, 2, and 1. That one was the letter F. Great job. Same line, line number 2, but the letter next to it. Good. So, right there. What letter is that right there? Good. That one is the letter. Good job. That one is the letter P, like pillow. Good job. We're going to move on to line 3 now. And then we're going to skip the lines to the last line, okay? Good. So, moving on to line 3. Are you ready? You're doing so good. So, what letter is that one? Right there, what letter is that? That is letter... Good. C, or the letter Z, like zebra. Good job. And what about that letter right there? That letter is good. The letter T, like a cup of tea. Now, what is the letter that's right in the middle? What letter is that right there? That is the letter O. Great job, like orange. Now, I said I was going to skip to the last line, so we're going to skip to it. The last line is right here. Can you tell me what letter that first letter is right there that I'm highlighting? Let me know in 3, 2, and 1. That is L. Good. And what letter is that right there? The last one. Let me know in 3, 2, and 1. That is H. Good job. A bit up close now. I'm gonna ask you first, are you someone who happens to have color partial vision? It is okay if you do. I'm now going to proceed with what we call the red color test. Now, I'm going to ask you which square has the color red. Okay? And I'm going to also ask you between two separate objects, which object is red. Shall we begin? Good. So, out of the two squares here, which square is the red one? Is it square 1 right there? Or is that square 2? Which square is the red one? This one is square 1, and this one is square 2. Which one is the red one? Let me know in 3, 2, and 1. Good. This is the red one. Square 1 is the red one. Good job. Moving on between two other objects. Let me know which one is the red one. I have two different lights here, and I'm going to shine them in front of your face. You let me know if light 1 or light 2 is the red one. Let's begin. So, we have two lights here in front of your eyes. You let me know which one is the red one. This light on this side is light 1. And this light on this side is light 2. Take a close look and focus only on the one you think is red. Light 1 or light 2. So just quickly keep focus on the one that you think is the red one and follow it. Good. Keep focus on the one you think is the red one. Good. Keep focus. Good. Keep focus. Good. So which light is the red one? Light 1 right there, or light 2 right here? Let me know in 3, 2, and 1. Good. Light 2 is the red one. Good job. And now for the third and final red light test. Let me know when the red light is closest to you. I'm going to move the lights in different directions, but you let me know when I stop the movement. Is it closest to you or farther away? Okay, good. So, moving the lights now carefully farther or closer away to your eyes. Is the red light closer to you or farther away? Closer or farther? Closer or farther there? Good, it is closer. Good, let's move the lights now. Good. Now, is the red light closest to you or farthest away? Closest to you or farthest away? Let me know. 3, 2, and 1. Farther away. And last time, is it closer to you or farther away? Closer or farther? Closer or farther? Good. This time it's closer. Good job. You did fantastic. Okay. And do your eyes feel tired at all? Are you starting to feel sleepy? How are your eyes doing? Okay. Good. You did amazing. That was the first part of the cranial nerve exam. We just tested 4 of the cranial nerves revolving your eyes. We are going to move on now to what I think is the most fun part of the cranial nerve exams, which is the olfactory sensory nerve exam. We're going to test your nose and your sense of taste, okay? What we're going to do is I'm going to ask you to please close your eyes and do not look. But I have essential oils right here next to me. And I'm going to ask you what essential oil you smell. All you have to do is pinky promise that you won't open your eyes and look at the answers, okay? Do you promise? Good. So, keep your eyes closed. And quick question before we begin. Do you feel like you've lost any senses of smell or taste as of recent, perhaps within the last 2 weeks or 2 months? Okay. Now, there are no correct answers with this test. Just try to be as accurate as you personally can be. No judgment here, okay? Good job. So, I'm gonna get the first one. Please keep your eyes closed. We're gonna start with the smell test. So, keep your eyes closed, but I have the first essential oil here. I'm gonna open it and place it under your nose, and you gotta take a guess what essential oil I have, okay? Just keep your eyes closed for this part. I love this one. So, keep your eyes closed, and could you let me know what essential oil you feel like you are smelling right now? Okay, you're getting citrus, very good. You're getting orange and lemon, and you're getting fruit, very good. Now, what essential oil do you think this one is? Take a guess at the smell. In 3, 2, and 1. Very good. You did great. This one is typically the easiest to do. This one is indeed an orange, but we would have accepted fruit, lemon, orange, citrus, anything. You're doing so good. Okay. Please continue to keep your eyes closed for this next one. I love this one a lot. You've definitely experienced this one before, okay? So, keep your eyes closed. I'm going to place this under your nose now. And what essential oil is this one? Okay, you're sensing floral. Very good. Flowers is great. You are sensing maybe an herbal tea, okay, or a spa. You are doing great. And you are sensing good, maybe cosmetics or some sort of lotion. Perfect. Any guess what this could be? 3, 2, and 1. Great job. This next one is lavender. You are doing so well. It is spectacular. Good job again. We would have accepted floral. We would have accepted sweet. We also would have accepted flower. And of course, lavender. You're doing so good. Okay. Here is the next one. Oh, stunning. You might get this one right away. You seem clever. Okay. And what is this one I'm putting right under your nose? Oh, yes, I knew you got it right away. Minty, refreshing, like candy. Very good. And also like toothpaste. That is exactly it. Any guess what this could be? Great job. You were very quick with this one. This one is mint, otherwise known as a eucalyptus. This one Perfect. Good answer. You're getting floral. Very good. I would say it's quite floral and quite earthy. Oh, you're getting perfume. Okay. And you're getting tea. It's very commonly used in teas. If not, it is the most common item used in teas. So what is this? Essential oil. Let me know in 3, 2, 1. Good. This one is chamomile. Or chamomile, however you pronounce it. Now, if you did open your eyes, it's understandable, but I think you would have gotten close to it nevertheless. This one is difficult, and they are getting more difficult as we proceed, okay? Good job. Okay. This next one, I think you're going to be a fan of. People often use this for a diffuser for your room to help you sleep. Oh, I quite like this one. Okay. So, keep your eyes closed. I know it might be tempting, but I'm putting this right under your nose now. So what is this essential oil that I am just wafting very close to your nose? Any guesses? Okay, it smells like medicine. It's often used as medicine, actually. It's often used in diffusers to help you breathe or for allergies. It's also often used to help treat any type of ailment on the skin. And it is very earthy. I will tell you, it really much so reminds me of sage, but it's not sage, I promise. Any guess what this could be? This one's very difficult. I'll let you guess in 3, 2, and 1. This one is tea tree. And this one, quite literally, it reminds me of something I used to apply to my skin if I ever had a little pimple or something. But this smells so good. The answers we would have accepted for this, by the way, are floral, earthy, neutral, and also citrus. Good job. And we have our last one now, okay? This one is either a hit or miss with everyone. Again, your answer could be wrong. It's okay. There are no correct answers. I love this one though. And this is the most difficult and final smell essential oil. So what does this smell like? Please do not open your eyes, even though it might be tempting, okay? Earthy. Smells like a tree. Very good. Smells like the beach. Good, okay. Or a fireplace. Okay, and it also smells like perfume. Any guess? This is the most difficult. Okay, I'll let you guess in 3, 2, and 1. This one actually is sandalwood. You can open your eyes now. And we would have accepted a plethora of answers just because this one is the most difficult. We're only trying to get that you got it's a neutral and earthy smell. So you did great. Good job. Okay. Next is the taste test. This is my favorite part of the exam. I have 2 tasting oils here. Okay, and I'll show you them. Okay. You can keep your eyes open for this part because the flavors are not listed at all on the bottles. But we have 2 different types of oil bottles here with 2 different types of flavors. You can either get 2 of these 3 flavors. It's either sour, sweet, or just water. So you've got to differentiate if one of them is just water, if it's sour, or if it's sweet. Are you able to differentiate those normally? Then this should be absolutely easy. We're going to start with this bottle. I'm going to ask you just to say ah, and I'm going to add just a couple of drops. Are you ready? Okay. Remember, sour, sweet, or nothing at all. That's the flavors you got to choose from. Please say ah. Good. And just relax. And then just taste. Is it sour, sweet, or nothing at all? Good. That one was sour. Very good. It's actually lemon juice. I'm glad you got that. Very good. Now remember, the options now are sweet or nothing at all. Shall we begin? Good. And please say ah. Good. And taste. Sweet or nothing at all. Good. That one was absolutely sweet. Very good. That one actually has the flavor. This is not a joke. It is the flavor of pure sugar. It's very sweet. You did fantastic. Good job. Now, I will ask you, did this feeling of you tasting and smelling any of these essential oils or the taster droplets, did it give you a headache at all, or did it make you feel quite sleepy or normal? Okay. Good job. Okay, very good. Good. Next, I'm actually going to test your ears and your musculature. Do you happen to suffer with any cases of vertigo or perhaps imbalance throughout your daily types of weeks or whatever? Okay. And do you have any troubles with your ears or hearing? Are you hearing partial? Okay, that's okay too. Remember, none of us are perfect, and it's okay to be hearing partial or to be hearing everything completely. Just let me know if there's any issues, okay? I'm gonna test your ears now with something known as a tuning fork. I have 4 tuning forks here. What I want you to do is just let me know if you hear the sound. Okay? So, yes or no. I'm going to tap the tuning fork and you let me know if you hear it, okay? Good. So, let's begin. Once more. Yes or no to number 1. Good job. Okay. Yes or no to number 2. Yes or no? Okay, good job. Number 3. And could you hear that? Yes or no? Okay. This one is the last tuning fork. All I want you to do is let me know if you can hear it, yes or no. I will let you know in advance. This one is the most difficult to listen to. It's a very different tone. So just let me know if you can hear it, yes or no, okay? Good, let's start. And can you hear that, yes or no? Once more. Yes or no? Okay, good job. Okay. I'm going to test your eyes, ears, and musculature now. And this will be the final part of the cranial nerve exam. So far you've done so good, okay? What I'm going to do is I'm going to manipulate and turn your head and your neck. You let me know if you can still hear and see the things I tell you to hear and see, or if it happens to give you any sense of vertigo, okay? First, I'm just going to place my hands around your ears. Is that okay with you? Good. And I'm just going to get my hands right there, okay? And you feel like any pain or pressure when I put my hands next to your ears, yes or no? Okay. And I'm going to ask you, just relax. I'm going to just carefully tilt your head and ask you a couple of questions. I'd like so. Okay. Can you still see me? Good. What I want you to do is let me know when my hands are no longer in your peripheral field, okay? So let me know. When do my hands disappear? When do my hands disappear? Good. And let me know when they disappear. Good. Okay. And can you see the light still? Good. And what about here? What about here? And what about here? Good job. Okay. Let's tilt your head the opposite direction now. Okay. Can you still see me? Good. Let me know when my hands disappear. Good. And what about here? Good. And what about here? Good. And let me know, can you see the light here? And what about here? And what about here? Good. I'm gonna move you right back to normal now, okay? Let me know. Are you feeling okay? Any sense of vertigo? Okay. Let me know when my hands disappear. Good. And what about now? Good. And what about now? Good. And quick question. Do you see the light here? Good. And what about here? Good. And what about there? Good. Now, I'm just going to hold your face while I do it. I'm going to ask you to mimic me or to just move your muscles a certain way, okay? I'm going to ask you just to scrunch your face up or make emotions, okay? Good. So, I'm going to put my hands close to your face. Can you raise your eyebrows for me? Good job. resist. Okay, resist, good. Resist, good. Resist, good. Resist, great. Resist, good. And resist, good. And relax and keep your eyes normal. Good. Now, can you give me a really nice smile? Very cheesy. Just give me a smile, okay? Good. 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 Now, keep your smile, but don't allow me to pull your smile down, okay? Good. And resist. 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 And resist. Good. Relax. And are you able to frown at all like that? Frown, please. Good. Good. Keep frowning. Good. 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 And relax. Now, can you lift your shoulders up like that for me? I'm going to put my hands on each of your shoulders, and I want you to resist me pushing down on them, okay? So lift them. I'm going to push down, resist. Good. So, please, and raise your shoulders, resist. 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 Good. Relax. Now, can you keep your hands out for me? I'm going to push right on your hands. Just keep resisting me from pushing my hands closer to you, okay? So, keep your hands up and resist. 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 And good. Now I just want you to shake my hand, both hands, okay? So shake my hand. Good. And shake my hand. Good. Now touch your nose. Good. Now with your hand, touch your nose and touch my palm. So nose, palm, good. Nose, palm, good. Nose, palm, good. And nose, palm, good. Good. And last but certainly not least, I'm going to do something called a sharp and a dull test. And I always finish off with some sort of exam that allows you to close your eyes. So, I have a little tool here. One side is very soft, and the other side is just a little sharp. What I want you to do is keep your eyes absolutely closed, but I'm going to just apply a little bit of pressure on either the soft side or the sharp side, and you let me know what side I have on your face. So keep your eyes closed, okay? Let's start. Soft or sharp? Let me know in 3, 2, 1. Soft, super good. Okay, soft or sharp? Soft or sharp? Sharp. Good, soft or sharp? Soft or sharp? Sharp. Good. On the chin. Soft or sharp? Soft or sharp? Good. Soft or sharp? Good job. Soft. And one more on the forehead as the last one. Soft or sharp? Keep your eyes also closed. Soft or sharp? Guess in 3, 2, and 1. Soft. Very good. You may open your eyes now, okay? Good. And how do you feel? Very good. That was the entire absolutely detailed cranial nerve exam for sleep. Are you feeling okay? Good. What we're going to do now is, with all the results I collected from your cranial nerve exam, I am going to create a sleep schedule and study for you that will help you sleep, relax, and recalibrate all of your cranial nerves, okay? Yes, indeed. As well, what I'm going to do here is we're going to let you stay at our sleep clinic here at was an absolute pleasure taking the time to perform this exam with me today. Thank you for giving me your time. I am more than honored. Again, I'm Dr. Brain. Some call me Dr. Cranium for cranial nerve exam, but I will be retesting you come morning time, okay? As well, on your health portal online, you will receive the full detailed exam, and you can rewatch it anytime you want. In fact, we highly recommend that you repeat the exam whenever you feel like you need to find sleep or to retest your cranial nerves for whatever reason, okay? Your health is our priority. I'll keep saying that until the end of all the exams, and then I'll say it again. So, find yourself in the sleep clinic. A nurse will come by now to take you to your specific room, and we'll retest you in the morning, okay? Sweet dreams. Have a good rest of your night, and thank you for coming to Dream City Clinic. Ciao now. Okay, detailed cranial nerve completed. Perfect. Let's have the front desk send the patient on in for the extremely detailed cranial nerve exam. Good. And let's make sure I have all their sign-ins ready. Okay, here too, and they should be here any second. Oh. Hello there. Welcome to Dream City Clinic. The front desk just sent you on into the exam room, correct? Good. You're here for the very detailed cranial nerve exam, is that correct? Great. Please come on in, make yourself comfortable, and if you could, just take a seat right at that exam chair. Yeah, it's just right in front of me. Just sit down. Yeah, and you can lay down on it too. Just relax all your muscles. No need to be stressed, okay? Good. I am Dr. Brain, and I will be performing your detailed cranial nerve exam today. Is that okay with you that I'm your primary care physician? Good. Pleasure to meet you. Good. And how was your day today? Okay. Okay. And did you find it easy to come here for your appointment today? Any traffic? Okay. If you ever need a ride, let us know because we can offer a transportation service. Okay. So before we begin, have you ever had a cranial nerve exam before? It's okay if you haven't. Okay. And today's assessment will be extremely detailed. I'll pull it up on my little iPad here. We're going to be performing 12 separate tests, extremely detailed on you, going through all of your 12 cranial nerves, okay? And we're going to be asking you to do different medical tests and procedures to make sure all of your cranial nerves are working properly, okay? Your health is our priority. And if at any point you want me to stop doing an exam or switch it up, just let me know and I will conform the exam for your experience, okay? Good. A lot of people think this is the best exam. It's called the olfactory sensory nerve exam. It's the smell test. I'll be doing that right after I check your eyes. It's the best part of the exam in my opinion. But are you ready to begin? Good. Just relax, okay? We're going to first start off just by asking you for your name and the spelling. It's a beautiful name, by the way. And have you had any issues sleeping recently? It says you're here for the cranial nerve exam because you've had some trouble sleeping or not sleeping as well. Okay, and do you wear contacts or glasses? Okay. So, let's begin. We're first going to start off with an optic test, and it's a bit like taking your vitals, okay? My hands are clean. and I'll put gloves on after this part, but I'm just going to get up really close and I want you to let me know. Are my hands close to you or far away? I might touch your face at some points if that's okay with you. Good. Let's begin. Just a bit of vitals to check your eyes, and then we'll take your temperature, etc. Let's start. So, are my hands close up to you or far away? Good. They are close up. And are they wiggling, or are my hands staying still? Wiggling, okay? Okay. Let me know. Are my hands close up or far away? Far away. Are they wiggling or staying still? Good. They're wiggling. Okay. Close up or far away? Close up. Are they moving or staying still? Still. Good. And now once more. Close up or far away? Good. And are they moving or staying still? Good job. You did great. Okay, I'm going to get a little bit of your oxygen level here. Could I get one of your hands? Good. I'm just going to place this on your finger. Okay. Let's count down from 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. And your rating is 98% oxygen level. That's perfect. Okay. Let's check your temperature now. Have you had a cold or flu within the past 2 weeks or felt cold or flu-like symptoms? This includes fever. This also includes body aches. This also includes runny nose, stuffy nose. Okay, any of that? Okay, I'm just going to check your temperature now. I'm just going to put this right on your forehead. All you have to do is just follow that circle, okay? Just look at the circle and start. Good, and once more, follow the circle. Perfect. And then look at that circle. We're going to test right at the center. And then a little bit below. Perfect. So we're looking at an average 98.5 degrees Fahrenheit. Okay, and your average was 98.5. Good. Now I'm just going to carefully check inside your ears. Okay. And let me know, can you feel this in your ear? Just take a look right there. Good. Okay, looking good. Any sensitivity in your ears at all? Okay. Do you happen to wear a hearing aid or have any hearing partialness? Okay. Other ear, let's just take the little vitals. Okay. Good. And can you hear that just moving around in the ear? Good. Can you look right there for me? Good. Look right at my ear. Good. Good. Okay. Now I'm just going to shine this light right at your eyes, okay? Do you have any sensitivities with your eyes? Okay. I'm going to ask you to look right at that circle first. I'm going to just be taking a quick look inside your eyes, okay? Look at that circle. It's going to move up, and it's going to move down. And look right back at that center. Good. Now, can you look back at my ear right there? Just right there, look at my ear. Good. Good. Other side. Let's see here. Can you look at that circle right there? Good. I'm just looking right inside your pupils. Good. We're going to move that up. Follow the light. And we're going to move that down. And then right back at the center. Can you look at that light? going to ask you again, do you think you can look right there at my ear or my earring right there? Good. This one's going to get a bit up close. Just look right there at my earring, right there. Good. Keep looking there. Good. Now between the two ones, look at the circle again. Good. Good. Follow the circle. Great. Good. Good. Good job. What I was looking for, especially with your cranial nerves, is I'm searching for something called nystagmus. That could be when your eyes, they move back and forth very quickly because they're very sensitive. Okay. I'm also looking for differences between the dilation between your eyes, which is a very important part of the cranial nerve exam. I'm going to get my gloves on now. And we're just going to test your eyes and then your nose. Have you had any issues with your vision or changes within your vision within the past 2 weeks to 2 months? Perhaps you're finding it more difficult to see long distances or up close, or perhaps you're seeing spots, anything like that. Okay, I'm going to check a little bit up closer now if that's okay with you. I'm going to check with a pen light. Like this. I'm gonna ask that you follow the light for me if possible. If it bothers your eyes, look away, okay? Okay? And if again at any point you don't like this part of the exam, tell me to move the light away or close your eyes, okay? I'm looking specifically right at your eyes, so just follow the light for me if that's possible. You're doing good. I know it's a bit bright, I apologize. A lot of people find this part to be very sleepy. So I'm just scanning your vision. Great. Just follow the light. Good. Spectacular. Good. Great. Okay, and relax. Look at me. Look at the light. Look here where my hand is moving. Look at the light. Good. Look at my forehead. Nose. Chin. Can you look at the letters on the wall right there? Good, and look at the light. Me. The light. Great. Now I'm going to get a bit more up close. We're looking at the ocular motive nerve. And what I'm going to look for is to see if your pupils are dilating properly. What I'm going to ask you to do is just let me know by raising your hand like this when you see the light flash in front of your eyes, okay? So I'll give you an example. If the light's right there, and if it's not, put it down. If it is, raise. If it's not, put your hand down. Simple. Okay. So just focus for the light. Now, are you ready? Let's begin. Good, your hands up. I'm just gonna move your eyelashes out of the way while I do this. Good. Good. And relax. Good job. Let me write down some information. So, the trochlear nerve was perfect, and your ocular motive one was good. We're going to test it again. We're going to ask you to look at the light, and I'm going to ask you just to follow it with your eyes, but let me know if it's getting closer to you or farther away, okay? Good. This will be your trochlear test. Okay. Look right at the light, and we're going to call this distance the baseline. All you have to do is let me know if the light's moving closer to you or farther away. Sound good? Good. So closer or farther away? Okay, closer or farther away? Good, closer. And let's start back at baseline. Okay, closer or farther away? So is that closer or farther away? Closer. Good. Baseline. And closer or farther away? Farther away. Or closer? Farther away. Good. Okay. Other side. This is baseline. Closer or farther away, okay? So baseline. Closer or farther away? Closer. Good. Baseline. Closer or farther away? Farther away. Good. And closer or farther away? Farther away. Spectacular. We're looking for your pupils to constrict and dilate, and also that you're able to test distance. And we're checking for your reaction to light and to observe the response of your eyes. Okay, good job. Okay. Okay. Now for this next part, I'm going to have you read for me. I'm going to pull up my smaller Snellen's chart, and I'm going to move it a simple distance, about 14 inches about, and I'm going to point to a letter and I'll have you read it. Okay? Do you think you could do that for me? Good. Let me get the Snellen's chart. Okay. Here is my mini Snellen's chart. Very similar to the big one, but we go a little bit closer with this test, okay? I'm going to point in a letter, and I want you to read it for me, okay? Good. Let me get a light to point at it. Let's begin. We're going to move this 14 inches away, so right there. Let's begin. We're going to start off right there with this top letter. Can you read that top letter for me? Good. What letter is that? Let me know in 3, 2, 1. That is an E. Good job. Okay. Let's move on down to line 2. Okay. Now, let's point at a letter right there. What letter is that? Okay, let me know in 3, 2, and 1. That is the letter L. Very good. And second letter in line 2, what letter is that? What is that right there? Let me know in 3, 2, and 1. That is T. Good job. Okay. We're going to go on to line 3 now. Let me know right here. What letter is this one right there? Is it first in the line? What letter is that? Let me know in 3, 2, and 1. Good, that is F. And what about the letter next to it? Take a guess in 3, 2, and 1. That's P. Good, and what about this one over here? Take a guess. 3, 2, and 1. Good, that's H. Good job. What are you noticing based off of the top letter at the line number 1 all the way down to the bottom letters at line number 8? What's happening between these numbers, these letters? Is there a difference between this letter and this letter? What are the letter differences, or what's happening between these letters? Very good, they're getting smaller. Do you have difficulty reading this last line? Okay, we're going to jump right to this last line then, okay? Good. Are you able to read this letter from this last line right here? The first one. Take a guess in 3, 2, and 1. That's L. Let's move all the way to the last letter of the last line. And what letter is that? Take a guess in 3, 2, and 1. It is H. Good job. Okay. Which line does it get more difficult for you to visually see from about 14 inches apart? I'll just keep the line going, and you let me know where it gets to be more difficult. Let me know when. About this line? Okay. I'm going to move it now about 36 inches away from you. Let me know which line gets to be a bit more difficult. About right there? Good. And I'm going to point at this now and start behind me now. Are you able to read this top letter? Good, and what letter is that? Let me know in 3, 2, 1. That's E. Good job. And rolling down this line here, I'm going to go straight to the bottom line. Are you able to see what letter that first one is on line number 11? What visual line is that, or what letter is that? Guess the letter in 3, 2, 1. This one should be very difficult. No worries if you didn't get it. That's actually the letter P. At this distance, that would have given you, I think it would make your vision 10 out of 20, which is really good. But it's very difficult. Most people stop right here at line 8. As beyond that, it gets a bit difficult. You did great. Good job. Okay. We're going to test with a color visual acuity test now. I have 7 different color sheets, and all you have to do is tell me what color is the sheet that I put over your eyes, okay? Let me go get that. Perfect. Okay. I have the colored sheets now. Do you have any color partialness? Perhaps there are some colors you can't see. Okay, that's okay, I do too. There are very difficulties I find with several shades of orange and pink, so no worries if you can't see colors. Neither can I for some parts. I'm going to put these sheets over your eyes, and what I want you to do is guess what color it is. Okay? Let's begin. This is going to change the way that your vision looks, so I'm just going to ask that you take the best guess that you can, okay? Let's start. So, I put this right over your eyes. Okay? What does this change your vision to look like? What color does that look like to you? Good, that's blue. Very good. Good job. On to the next one. Just gonna move that right over your eyes, okay? And what does this layer look like to you? What color does that change into? Take a guess in 3, 2, and 1. Good, that's pink. Very good. Okay, you're doing great. This one's a bit more difficult. I'm just gonna put that right over your eye. What does that change your vision to? Take a guess in 3, 2, and 1. Good, that's yellow. Fantastic. Great. What does this layer do? I'm gonna add that filter over your eyes. Okay, and what did that change your vision to? What color is that? Take a guess in 3, 2, and 1. Good job. That is purple or violet. On to the next filter. What does this change your vision to? Okay, take a guess in 3, 2, 1. That makes your vision pink. Perfect. You're doing amazing. I'm so proud of you. Good. Okay. On to this one. What does this filter change your vision to? What color is that? Take a guess in 3, 2, 1. This one's a bit more difficult. It is a light orange. Good job, you're doing great. Good. And 2 left. What does this change your vision to? Take a guess in 3, 2, 1. Perfect, that's green or teal. Good job. And on to the last one. I'm even going to test something with this last one. Are you ready? Let's put this filter over your eyes. Take a guess. What color is that? 3, 2, and 1. That's red. Very good. This is actually a really important color. And I'm going to ask you, are you able to see the light right here that I'm shining through the filter? Good. And what color is the light? It's red. Good. Can you just follow that light with this filter? Good. Good. Look up. Look down. Look to the center. Great job. You did fantastic. I'm super proud of you. So, we're going to move on to my favorite test now. A lot of people love this part. We're going to go on to the olfactory sensory nerve test, which is a sense of smell and a taste test, okay? We have finished your optic nerve test, your ocular motor test, your trochlear test, and your trigeminal test. That's all with ocular motor functions with your eyes and your visual acuity. Good job. You're doing great. So we're going to go to the olfactory sensory test, but I'll show you what we're going to work with. Okay, so I have a box of essential oils here, and they're very simple smells. There's nothing too wild about these smells. What's going to happen is I'm going to ask you to close your eyes, and there are no correct answers for this, but I want you to smell and take a guess what the scent is. So I'll repeat back to you your thoughts because you'll say them out loud. There are no correct answers. We're just looking for something that's relatively close to what the essential oil is, okay? Great. So let's begin. I'm going to ask you just to close your eyes for this part because this is all about your sense of smell. We're checking to see if you can smell anything and just to take a guess as to what it could be or around that. You don't have to be correct, it just has to be close, something similar. Okay? Great, let's begin. I'm just going to ask you to please close your eyes and don't open them during this part of the exam. Good, close your eyes. Good. We're going to start off with our first essential oil. keep your eyes closed. This first essential oil is going to be really close to your nose. You just take a guess what you think you smell, and just say out loud what you think it could be or what it's getting close to. Let's begin. So, the first essential oil is right under your nose, okay? And this one is such a nice fragrance. What are you getting from it? Citrus, good. Fruity, so fruit, good. Okay, it smells like, okay, oranges, good. Anything else? No, it's just smelling like oranges and citrus. Is that your final guess? 3, 2, 1. Good job. You did great. This first one is orange. You did fantastic. Let me write that down. Good job. Keep your eyes closed. We're going to move on to the next one, okay? Good. Oh, this next one's great. One of my favorites. So, next one's coming up. Before we begin the next one, just breathe in. Breathe out. Good. We don't want to mix the smells. Let's start. Oh, I love this next one. Okay. This next one's right under your nose now. Okay, and what does this one remind you of? Yes, it's very minty. Very good. Mint is the word. It's cooling. Good. So this one is a cooling scent. And it reminds you of candy, of peppermints, and like winter time and cold air. Okay, well, you seem to be on the nose. What do you think this essential oil could be? Take a guess in 3, 2, and 1. Fantastic. This one is peppermint, and we would have accepted mint or cooling. You did great. You are doing super good at this test. Let me write that down. And did you find any of those 2 scents soothing so far? Perhaps the peppermint. Okay. Good. I wrote that down on the little computer here. Let's move on to the next one. Keep your eyes closed, okay? We're on to the next one now. Keep your eyes closed. So, we're gonna open that up. Oh my gosh, this smells so good. This one literally smells so good. Okay. I'm putting that right next to your nose. And I want you to take a guess what you think that is. You're getting spa, floral. You're getting floral. So very strong floral notes. It reminds you of a tea. Good. It reminds you of lotion. It is often found in lotions and tea. And it just reminds you of a spa, like a flower spa. Good. And what's your guess in 3, 2, and 1? Good. The answers we would have allowed would have been floral or sweet. So you did great. This one is lavender. And I think you've got it. Good job. Okay. Keep your eyes closed. We're on to the next one. Okay. Let's start off with this one. It gets a bit more complex past this point. So just have faith with me. Now this one is either you identify it right away, or it's a little bit more difficult to guess. Okay? I love this one though. This is a personal fan favorite of mine. Okay? And what essential oil do you think that is? It's right under your nose. Keep your eyes closed, okay? Okay, you guessed floral. Correct. You're guessing like a tea. Perfect. This is often used for sleepy time teas. Okay, and you're guessing calming and a warm scent, and it's just floral. Okay, and it's used for teas. So any guess in 3, 2, and 1. Good job. This one is actually chamomile, and your guess was so good. Good job. Again, for this one, we would have accepted floral. We also would have accepted sweet, and we also would have accepted earthy. You're doing so good. Good job. Okay, I'm gonna add that onto the computer here. Okay, we're gonna give you a break between the next set of scents. So just simply breathe in and breathe out. Breathe in and breathe out. Good. And do you feel tired or soothed at all by any of those scents so far? Good. Which ones did you like the most? Good choices, okay? Are you feeling tired or sleepy right now? Good. That's exactly what we want. Great. On to the next one. Close your eyes, keep them closed. Oh, perfect. Okay. Keep your eyes closed. We're going to put this one under your nose now. Okay. Breathe in. And breathe out. And what does this one smell like? Okay, you've got mint immediately, you've got refreshing, and you've got cooling. Okay? But this one's a bit different than the other one. This one is a different scent in the same category, okay? These are also both used for teas, they're both used for spa scents, and they're also both used for candy. Any guess? 3, 2, and 1. Good job. Mint is an acceptable answer. This particular one happens to be eucalyptus. It doesn't matter though, because we're just looking for mint or refreshing or cooling. So you did great. Okay. And we have 3 more left to go. Are you ready? Good. This is going to get more difficult now for the last 3. Are you ready? Let's go. So, keep your eyes closed. This next one, I love. Okay. So, this one's right under your nose. Okay? And this one is oh so soothing. What does it smell like to you? Keep your eyes closed. It smells like, yes, perfect, a fireplace or a fire pit. Perfect. It smells like the outdoors or a forest. Good. And it smells like a tree or wood. Correct? Perfect. And perhaps even wood bark. Is that what I'm getting from you? Good. Is that your final guess? 3, 2, 1. Very good. That absolutely was correct. This is called sandalwood, and it's a very earthy scent, very warm. You got all the guesses correct. Good job. Okay. 2 more to go. Okay, we have the next one. Keep your eyes closed. Oh, this one, I completely get this one. Okay, it's right next to your nose. And what are you getting from this specific scent? Okay, it's citrusy, but not like lemon. Perfect. It's earthy, but not like a tree. Good. And what would you guess this could be? A plant? Marvelous. Is that your final guess? 3, 2, 1. Good job. This one's actually vetiver, but vetiver, the plant, is kind of a natural smell. It smells like the outdoors, but it also has a hint of citrus, so you did fantastic. Good job. You have a super nose. And we're on to the last one here. And I love this last one. Okay, let's begin. Keep your eyes closed. And you'll be able to open your eyes after this next one, okay? Let's start. Oh, I love this one. Okay, and what essential oil do you think this could be under your nose? What scents are you picking up? Okay, this smells like the outdoors like plants, but it has a medicinal herbal scent that's perfect. And it smells a bit like, yes, like plants, perhaps even like a garden. That's marvelous. And what is your guess? In 3, 2, and 1. You can open your eyes now, by the way. Good, you said the right notes. This is called tea tree, and it smells like a garden because it really is just from the garden. It's a perfect scent, and for this specific one, we're looking for outdoors or like plants. So you did amazing. I'm so proud of you. You did so good. Good job. Okay, we're gonna move on to the taste test now. You can keep your eyes open now, so open them if you kept them closed. Okay, just open those beautiful eyes. Good. And for this taste test, I have 3 bottles, and they all look the same. So I'll show you one. We have different bottles here, and each of these bottles has a different taste. Okay? So, for one of the tastes, the taste is peppermint, minty. For another one, the taste is sour, so it's lemon. And for a third taste, it is super sweet, like sugar. So, we have minty, like peppermint, sour, like lemon, and sweet, like sugar. Okay? I'm going to give you all 3 taste tests, and you tell me which one is which. Shall we begin? Good, let me get the bottle. I'm going to shake this up first. This is the first one. You won't be able to tell the difference between the 3. So it's minty, sour, or sweet. Let's begin. Say ah. And can you taste that? Just go. Good. And what was that? Very sour. You got that one right away. So your mouth do that. Good, let's get the other one. Okay. On to the next one. Let's begin. Shake it up. Good. Okay. Say ah. And taste it. Go like that. Good. And what could this one be? Good. That one is peppermint or minty and refreshing. Perfect. And on to the last one. Okay. We're mixing them up here. What's this last one? Are you ready? Say ah, and we're going to drop that in like this. And taste that, just go like that. Good, and what was that last one? Ultra sweet. You did great. So, it looks like your olfactory sensory nerves are fantastic. Perfect. So we've identified a smell test, we've identified a taste test while also keeping your eyes closed. That's perfect. And we're also just going to identify that you can taste the difference between different types of tastes: sour, sweet, salty. Perfect. And you did all the smells correctly. So let's move on to the next part of the exam, shall we? Perfect. So we are going to start off with a facial nerve test and a muscularity test. Okay? So I'm going to first grab my tool here. It's right in front of me here. Okay? And I'm just going to tap on your face at different areas. And I want you to try your best not to move away from every area that I just tap on, okay? Okay, and as well, when I tap on your face, let me know when you feel it by saying now. So, if I tap here, you say now. If I tap here and you feel it, you say now. Let's begin. So I'm going to put my hand right there. Let's begin. Good. What about here? Good. Here. Good. Under the eye. Good. Nose. Good. Here. Good. Chin. Good. There. And can you feel that here? Good. And what about right below the nose, above the lip? Good. There. Good. Here. Good. Great. Let's test the forehead. Just the top of the head next to your scalp line with your hairline, okay? Here. Good. There. Good. Here. Good. What about there? Good. There. And here. What about here? And then below the chin. Good job. Great. Okay, I'm going to test the collarbone all the way to the shoulder. Let's begin. Can you feel that here? And here? Here? And what about there? Here? There? Good. And here? Good. And give me your hands. Okay, I'm going to just try your reflexes right there. Can you feel that there? Good. Reflex on your hand. I'm going to test here now. Good. And now on your other arm, let's test the reflex next to your elbow. Good. In your hand. Good. Good reflex. And I'm going to test your knee now. I'm just going to test the reflex right next to your kneecap. Just try not to kick me, okay? Good. Let's try it. Good reflex. One more. Great. And here. Good. And once more. Great. Good reflexes. Okay. This is absolutely perfect. So that means that it looks like your musculature is good for that. I'm going to ask you just to follow my facial features now. Just give me a second to set this up. Let's begin now. So, I'm going to get up really close to you. And what I'm going to ask you to do is follow the different types of facial shapes that I make. So if I open my eyes really wide, I want you to do that too, okay? I'm going to put pressure on each time that you do that. And we're going to see if you can keep your musculature, okay? Perfect. Thank you for allowing me to do this. So, let's start. Raise your eyebrows like if you were shocked. Like that. Let's start. And raise them. Raise them. Raise them. Raise them. Raise them. Good. And relax. Now, can you furrow your brow like that, as if you were questioning something like this? Good. Put my hands there and furrow your brows. Furrow, 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 furrow. Good. And relax. Okay. Open your eyes very wide like that. Good. And open. 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 Good. Can you relax your eyes now? Good. And close your eyes super tight. I'm going to try to open them with my fingers. I want you to resist. Okay? So, close your eyes. I'm going to get up really close. Resist. 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 And relax. Good job. Okay. Look all the way up for me like this, but keep your chin still. Good. Look all the way down, but keep your chin still. Look over here, but keep your chin still. And look over there, but keep your chin still. Good job, okay? Now can you give me a smile like that? Good, Good, and try to resist me pulling it down. So smile. Resist, 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 resist. Good. Give me a frown like that. Good. And resist me pulling it up. Resist, 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 resist. Good. And relax. Now, I'm going to put my hand right there, and I want you to make this sound go ooh. Okay? And make that sound go ooh. Good. Relax. Now go ah. 3, 2, 1. Ah. Very good. And relax. Good. Now I'm going to ask you, can you do this? Do that. Good. And then can you just swallow like this? Good. And I'm also going to feel around your lymph nodes. So just swallow. Good. Any difficulties with that, by the way? Okay. And then I'm feeling your lymph nodes. Your lymph nodes feel great. Good job. Okay. Now, I'm going to ask you to raise your shoulders like this. And I'm going to put pressure on them, and I want you to resist me pushing them down, okay? Let's start. Raise your shoulders. Resist. Resist. Good job. Resist. Good. And relax your shoulders. Go like that. And now, shake my hand, and I want you just to squeeze my hand as tight as possible, okay? It won't hurt me. Okay? Let's start. Grab my hand, squeeze. 2, 1. Okay, relax. The other hand. Shake my hand and squeeze. 3, 2, 1. Good, and relax. And now, can you just wiggle your ankles for me, as if you were just rolling them around? Good. 3, 2, 1. Relax. Okay. Any issues with flexibility, or perhaps any issues with your articulations? Okay, thank you for letting me know. Okay. Now, what I'm going to do is I'm going to ask you to just do this. Good. And move it to the side like that. Good. And do that. Good. Okay. Keep your eyes here. Look at me. And don't get distracted by my hands. Good. Look right there. Don't get distracted by my hands. Good. Look at my forehead. Don't get distracted by my hands. Great. Okay. I'm going to tilt your neck and your shoulder a little bit now. Tilt them different directions. And all I want you to do is just let me move your neck. And I'll ask you a couple of questions, okay? So, let's first turn you a bit this way. Okay. How many fingers am I holding up? What about now? No. No. And no. Good. Let me know when my hand gets out of your peripheral vision. Good. What about now? And what about now? Good job. Let's turn you back this way and the other direction. Okay. And let me know how many fingers am I holding up now? Good. No. 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 And now, please ignore the airplane. Okay, let me know when my hands get out of your peripheral vision. Good. 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 Great. And once more. Good job. Okay. Let's put you right back to center here. Okay. Now, I'm going to give you a facial sensitivity test. You let me know if you feel warm or if you feel cool. Okay? So this is very important. I have these cooling ice globes here. And I have my hand, which is warm. You let me know if you feel the cool or if you feel the warm. That's it, okay? Good. let's begin. But I'm gonna ask you to close your eyes as it would be obvious, okay? So just close, close, close your eyes for this part. Okay? And you let me know if you feel warm or cool. Okay? Let's begin. Keep your eyes closed, okay? Okay, I'm just applying that to your face, okay? And what is that? Is this warm or cool? 3, 2, and 1. Cool. Very good. Warm or cool? Okay. 3, 2, 1. Warm or cool? Warm, very good. Okay. Warm or cool? Let's try again. And what is that? Warm or cool? Take a guess in 3, 2, 1. Cool. Very good. And warm or cool. Keep your eyes closed for this last part. And was that warm or was that cool? 3, 2, and 1. Warm. Good job. You can open your eyes now. Let's go over your results for your cranial nerve exam now, okay? You did so good. I'm so proud of you. So, let's go over the test results, okay? We are finished with your extremely detailed cranial nerve exam, the most detailed you've ever experienced. And let's go over all of your results. Okay, we went through all 12 cranial nerves. This includes the olfactory sensory nerve, that's your sense of smell, your optic nerve, that includes your eye and reading ability, your ocular motor nerve, which is why I kept asking you if you could just move your eyes across like so, your reaction to light, and your reaction to pupil accommodation, which was perfect. Good job. Now for your trochlear nerve, that's with the pen light. I was asking you if it was getting closer or farther away to see if you were able to tell distance. I also asked you to see if you could feel the light sensitivity, which you did, and I was testing your sense of sensation, which included cold and warm. Okay. with your abducens nerve, we were testing to see if you could follow the movement with your pen light just with the eyes alone, which you did spectacular on. There are many instances where people can't visually see without moving their head left and right, and sometimes that can be a result of a cranial nerve that is not working properly. For you, it is working marvelously. Okay. Now for the facial nerve, I was asking you to move your musculature around, like so, raising your eyebrows, raising your shoulders, testing your musculature to make sure everything was working properly as it should. And for you, it was. Okay. Now for your vestibular ocular nerve, we asked you for listening tests, and you did great. For your glossopharyngeal test, that was me asking you if you could say ah, ooh, ee. You did perfect. Now for the vagus nerve, we tested properly, especially with the pronunciation, and asking you to swallow for the part of the test and to speak. For your accessory nerve, that was you shrugging your shoulders and me asking you to resist the pressure I applied to your shoulders, which was spectacular, by the way. And onto your last cranial nerve, which was your hypoglossal. I asked you to do this, and you did spectacularly. Your cranial nerves are functioning so well. I'm going to finish up writing some of the details here, and you are also here to participate with the rest of the cranial nerve exam. However, you're doing this as a sleep study, correct? Good. I'm going to take notes down. We're going to close the lights in the room, and what's going to happen from now until the rest of the exam is we'll bring another nurse in to do what we call lights out routine. We will give you pajamas, your final meal for the day, and we will let you rest here while we rewatch and calculate all of your cranial nerves properly to see what we can do to improve your sleep and test your health, okay? So I'm going to sit here, take a couple of notes for a while, and you'll see the lights slowly go out. Is that okay with you? Good. And then afterwards a nurse will come in, bring you pajamas, and put you right to bed, or we will retest your cranial nerves in the morning, okay? Again, I'm Dr. Brain. Pleasure to meet you today. And thank you so much for coming to the most detailed cranial nerve exam that you've ever experienced for an ASMR experience. Pleasure to meet you, and we will see you in the morning. Perfect, let's take the notes now, and I will see you soon. We are waiting for the most detailed cranial nerve examination patient to arrive. I'll have the nurse send them on in. And it looks like this exam is going to go through every 12 cranial nerves with a detailed neurological assessment. Okay, and it looks like this is because the patient has been very tired. Good. I have all my tools and hello there. Perfect timing. Did a nurse just send you on in to come to my office? Fabulous. Pleasure to meet you. I'm Dr. Brain. It's good to have you here. First, before we begin the medical assessment, you're here for the extremely detailed cranial nerve exam assessment. Good. Just take a seat right in front of me, okay? There's just a medical chair there, and we can relax you to be leaning backwards, however you'd like, okay? Good. Just relax, and if you want to move the chair backwards, there's a little button pad right on the side. Okay? Good. Again, I'm Dr. Brain. Pleasure to meet you. Seems you're here for an over hour-long exam because you've been feeling extremely tired. And it says here that you may have bumped your head while watching Netflix attempting to fall asleep. Let me just check your head, okay? Does it feel okay if I put a little bit of pressure right there? Right, just right there. Okay, and what about here? Okay. Let me know if anything changes, okay? And if you need anything, let me know and I'll have a nurse grab it for you. Okay? Now, before we begin the medical exam, let me tell you what we're going to do. So, I have my informational iPad here. We're going to do an annual wellness checkup exam with cranial nerve exam. We're going to do an in-depth head and neck examination for all 12 cranial nerves. We're going to do just a general neurologic assessment, a reflexology exam, vision and hearing tests, and just a comprehensive examination of you in total. And these are the 12 cranial nerves. We're going to go and test your sense of smell, your olfactory, your optic nerve, your ocular motor nerve, trochlear, trigeminal, abducens, and etc. Completing all 12 cranial nerve assessments. Do you have any questions before we begin? Okay. Let me know at any point if you do not want to proceed further with a certain exam. If you have any sensitivities to lights, okay? You can also close your eyes during this exam. Is that okay with you? Okay. I'm gonna get my gloves on now. And we're first just going to get some of your vitals. Okay. And how has your day been? You're just tired. Understandable. Okay. So, first I'm going to get up really close to you. I'm going to put a little bit of pressure around your eyes. Is that okay? Good. Just let me know if you can feel it. I'll ask you now, and you say yes or no. Okay. Let's put a little bit of pressure there. Yes or no? Can you feel that here? Okay. No. 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 Okay. Okay. What I'm going to do now is I'm going to take actual physical vitals. Can I get your hand, please? Good. We're just going to get your pulse and your oxygen level, okay? So, hand, please. Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Let's see. Okay. Your pulse level is a bit elevated at 100 beats per minute. Are you a bit nervous? I hope you'll just relax for this, okay? We're gonna do nothing strenuous. In fact, most people fall asleep during this extremely detailed exam. And your oxygen level is at a 97%. That's very good. And information on you. Could I get your name with spelling? And do you spell your name with an I or an E? That's a beautiful name. And could I get your birthday with the year? Okay. Does that make you a Capricorn? Okay. And do you have any allergies that I should be aware of? Maybe allergies to medications or allergies to pollen, or perhaps you're allergic to some sort of plastic? Let me know. Good. Thank you. I'm gonna get your temperature, so I'm gonna get up really close to you, okay? Sit still and relax. You're gonna hear a beep. Okay, I'm gonna place this on your forehead. Okay, that is 98.6 degrees Fahrenheit. Once more. Okay. 98.6. And say ah. Perfect. That is at 100. That's great. And now I'm just going to quickly check your eyes. Do you wear contacts or glasses currently? Okay, and would you say you have a tougher time seeing things up close or far away? Okay. Just let me know. Can you see this light? And could you follow and look at it? Good. 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 A little closer now. Good. 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 Okay. Your pupils are dilating correctly. Do you feel a headache after I shine the light into your eyes? Okay. And just let me know. Focus on the light and follow it, please. Good. 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 Great. And once more. Good. 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 Great. Okay. So, eyes are appearing to be good. Now we're going to jump into your optic nerve and eye testing, okay? It's going to get detailed now if the light is too bright or if there's too many lights. All you have to do is close your eyes or tell me to skip this part of the exam, okay? Good. So, what we're first going to test and take some photos of your eyes. Okay. Can you look at that light and just keep your eye on it while I take some photos? We'll take about 10 on this side. Keep your eye on the light. Good. Optic nerve seems to be looking good. Okay. Other eye. Keep your eye on that light right there. We'll take 10 photos again. Okay, keep your eye on the light. Good. Optic nerve looks good there too. Okay. Do you feel like you need to take a break after looking at the light? We can continue. Good. Good. for this next part, I'm going to have you follow the light. And if I tell you to look elsewhere, please look elsewhere. I'll also ask you to close your eyes a little bit more than usual, but keep them slightly open, okay? Good. We're checking for motor functions with your eyes. That's it. Good. So close your eyes ever so gently. Follow the light. Good job. Good. Good job. Follow the light. Good. Good. Relax your eyes. Okay, look at the light. Look at my forehead. Look at the light again. Look at my hand. Look at the light. Look at my gloves. Look at the light over there. Look at my glove. Look at the light right there. Look at my fingers. Look at my fingers. Look at my fingers. Here. Here. Good. Can you focus on my hand in front of you? And move away. Focus on my hand. Move away. And focus on my hand. And move away. Good. Are your eyes feeling a bit tired after that? A lot of people think that when you're focusing on different things, it does tire the eyes out. Okay, that's good to know. Okay. Okay. Now I have a set of flashlights here. And what I'm going to do is grab my main flashlight, and the light is green. What I want you to do is focus on my hand, but as soon as you see the green light pass over your eyes, look at it. Okay? Good. What we're looking for is that your eyes are functioning well with a different set of lights, and that your focus is able to pay attention onto that light, okay? So first focus on my hand. When you see the light, stare at it. Good. Just look at my hand for now. Good job. Keep looking at my hand. Good job. Good. 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 Okay. Look at my hand even closer now. Good. 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 Great. Good. Good. Okay. Did you find that to be difficult, easy, or normal? Thank you. Okay. And now, what I'm going to do is ask you if the light is getting closer to you or farther away. Okay? Just focus on the light. I'll give you the base distance, and then you tell me if the light's getting closer from that distance or farther away, okay? Are you doing okay? Good. A lot of people think that this tires them out, and that's absolutely okay, okay? Good. So, here's the base location. I'm going to hold your head still. Try not to tilt your head, just use your eyes, okay? base location? Is it like getting closer or farther away to you? Let's start. Is that closer to you or farther away? Take a guess in 3, 2, 1. Closer, very good. Okay, keep your eyes still. Let's try again. Closer or farther away? Let's start. Here's the location. Closer or farther away? Okay. Is that closer or farther away? Farther away. Good job. You're doing great. Just keep focusing. Okay. Good. Here's the new start location. Let me know if it's getting closer or farther away, okay? Keep your head still. Closer or farther away? Okay. Is that closer or farther away? Take a guess in 3, 2, 1. Farther away. Relax your eyes. Good job. Starting position, closer or farther away? Okay. Is that closer or farther away? Take a guess in 3, 2, and 1. Farther away once more. Starting positions here. Okay. And take a guess, closer or farther away? Okay, is it closer or farther away? Let me know in 3, 2, and 1. It's closer. Good job. Okay. So that is closer. You're doing so good. Okay. Now, I'm going to just test your eyes if you are color partial or if you are color blind. And I have these pens here. I'm going to pull a pen up at random. What I want you to do is tell me what color you see. And again, there are no rights or wrongs. We're just testing to see if you have any color partialness, okay? Okay, let's start. I'm going to grab one at random. What color is this pen? Okay, this one is, take a guess in 3, 2, 1. This one is pink. Okay, let's pull a pen at random. Okay, what color is this one here? Take a guess in 3, 2, 1. Good. If you got orange, you were correct. Okay. What color is this pen here? Take a guess in 3, 2, and 1. Good. Did you guess blue? Let's grab one. Okay. We have this one here. Take a guess in 3, 2, 1. Good. Did you guess yellow? Perfect. Okay. Look at this one here. What color is this one? Take a guess in 3, 2, 1. If you said green, you were correct. And let's do one more. Okay. And here's the last one. What color is this one here? Take a guess in 3, 2, and 1. Did you guess red? Then you'd be correct. Good job. Let's write down your results. Okay. Good job. Okay. Now I'm going to test your peripheral vision. I want you just to keep your head still. Don't move your neck. Okay? And I'm going to move my hands out of your visual field. I don't want you to look at my hands. I want you to look right at my nose, my forehead, or my eyes. And let me know the moment you're unable to see my hands in your visual field anymore, okay? Good job. Let's start. Don't look at my hands. Look at me, my nose, forehead, or eyes. Let's start. Just say when you can no longer see them. Good. Okay. Once more. Tell me when. Good. Tell me when. Good. Tell me when. Good. Tell me when. Good, and tell me when. Good. Okay. Now we're going to do the opposite. Keep looking at my face, my forehead, eyes or nose. And let me know when you're able to see my hands enter your visual field. Don't move your neck or your chin, just use your peripheral vision, okay? So keep your eyes on my face, not at my hands. Let's start. Good. 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 Okay. I'm writing your results down. Do your eyes feel tired at all, or do you feel a bit overwhelmed? How's your head doing? Okay. Thank you. Okay. And now I'm going to test you with your eyes and your sense of thought. I have these items that I have glued onto these popsicle sticks. What I want you to do is as fast as possible. I'll give you 3 seconds to identify what the item is. All you have to do is say it out loud or think it, okay? And I'll tell you the correct answer afterwards, okay? I'm going to shuffle them up. And you take a guess at what each item is. Okay? Okay. Let's start. What's this item? 3, 2, 1. Good. If you said a cookie or a macaroon, you'd be correct. Okay. What's this item? 3, 2, 1. Good. That is a tomato or an apple. Okay. What's this item? 3, 2, 1. Good. That's a rainbow. Okay. What's this item? 3, 2, 1. Good. That is a sunflower, a donut, or a cake. Good job. What is this item? 3, 2, 1. Good. Those are cherries or plums. What is this item? 2, 1. Good. This is either a cookie, ice cream, or a macaroon. Did you see an item similar to this when we started? Good. This is the same one in a different color. Good job. Okay, 2 left. What's this item? 3, 2, 1. Good. That is either an orange slice or a lemon slice, depending on how you see it. And one last one here. You're doing great. What is this item? Take a guess in 3, 2, 1. Very good. Did you get either blueberries or grapes? Good job. Let me write those details down. You actually did fabulously on that. A lot of people, it takes a longer time to identify items, especially if they're tired or if they bumped their head. You're doing great so far. How are you feeling? Okay. Do you need me to take a break for a second, or is it okay if I just keep going through with this exam? Okay, good. I want you to let me know if there's any issues whatsoever. I'm not going to tell anybody. The only person that knows all of your information is me and this computer right here, okay? That's it. Okay? Good. Okay. I'm going to ask you some questions with an eye chart now. I have what is known as a Snellen's chart. I'll show you what that is up close, and then the item behind me. So, this is a Snellen's chart. There are letters on it, if you can see, and they are different sizes. I also have one behind me. Okay. I'm going to mix between the 2 charts. We're going to start with this one first. Okay. All I need you to do is look at the chart. I'm going to point to a letter. Just let me know what that letter is in 3 seconds, okay? Good. We're going to put this just a meter away from you, like so. Are you ready to begin? Good. What letter is the top one here? Take a guess in 3, 2, 1. That is an E. Correct. Okay. Are you still able to see the E now that I've moved it back just a bit? Good. Let's go to line 3. What is the first letter here? Take a guess in 3, 2, 1. That is an F. Very good. We're going to go all the way down here to this line. What is the second letter in? Take a guess in 3, 2, 1. Good. That is an F. Let's go all the way down to the final line here. Okay. And what's this last letter here? Take a guess in 3, 2, 1. Good. That is an H. Very good. Would you say from this distance this test was a bit easy? Okay. And did you have any difficulty with the final line here on this test from about a meter away? Okay. Now I'm going to show you these 2 squares. One of them is red and one of them is green. Can you let me know which one I am pointing at, the red square or the green square? Take a guess in 3, 2, 1. The green one. Good job. I'm going to take a step back now. And you're going to see this Snellen's chart on the wall here. Again, I'm going to point at the letters as I am a bit farther away from you now. Just try your best, okay? Good. Again, there are no correct answers. I just want you to attempt to the best of your ability. Okay? Good. So, I'm going to get a pen here to point at. Can you tell me what letter is this one that I'm circling? Take a guess in 3, 2, 1. That one is P. Very good. Let's go on to line 3. This is line 3 right there. What letter is this right there that I'm circling? Take a guess in 3, 2, 1. That is Z. Correct. Let's go to line 4. This is line 4. I'm going to point at this letter right here. What letter is that? Take a guess in 3, 2, 1. E. Correct. Have you had any difficulty reading so far? Okay, let's go down. We're going to move on a little bit more difficult to line 6. Line 6 is right above the green line right here, okay? Can you tell me what letter is this one right there? It's the second letter in this line. What letter is that? Take a guess in 3, 2, 1. Good, that is D. Very good. Okay, are you able to clearly read line 6? Okay, we're going to go into the more difficult lines, which is 7 and below. Let me know what I'm pointing at to the best of your ability. Again, there are no incorrect answers. You're doing so good, by the way. Good. Okay, line 7. What is the last letter in this line? 3, 2, 1. Did you get D? Good. Line 8 should be getting to be a little bit difficult. Last letter in line 8, what is that? Let me know. In 3, 2, 1. That is C. Good job. Okay, are you ready for the most difficult task now? It's the bottom lines. Let's start. Okay. First letter in 9 line. Take a guess in 3, 2, 1. Did you guess that that was an L? Exactly. It's very difficult. That's totally okay. But we're going to continue with the last 2 lines, okay? Okay. So line 9. First letter was L. Good job. Line 10. First letter. It's getting a bit tricky now. You're doing great. What's that letter? 3, 2, 1. Good. Were you able to see the F? Okay. Unable to see? And just a quick set of questions. Can you see the line 11 at all, or is it too difficult? Okay, good job. You did amazing. It's actually very difficult for people to read past line 8, so I think you did above and beyond. Good job. Okay, are you ready to one of the funnest part of the exams now? Good. This is my favorite part because I get to enjoy them too. We are going to be doing the olfactory sensory nerve exam now, which is your sense of smell and your sense of taste, okay? Good, I'm so excited. So, we're going to be giving you smells of these essential oils here. Now I ask you close your eyes because it will be super easy for you to open your eyes and spoil all the fun. But keep your eyes closed and just use your sense of smell and identify what these essential oils are. We're not looking for the perfect scent. We're not looking for an extreme note. We're looking for the general idea, okay? For example, if I were to put perfume under your nose, you either guess if it's floral, if it's citrus, etc. I'm not looking for you to identify specifically for each one, okay? Good. So, close your eyes. Do not peek. Do not pass go. Do not collect $200. keep your eyes closed. Breathe in, breathe out, and only use your sense of smell, okay? Good. So, let me set this up here. Are your eyes closed? Good. Keep your eyes closed. Let's start with this one. Close your eyes. Don't look. This one's amazing. Okay. I'm putting this one right under your nose. So, what does that smell like? Breathe in. Breathe out. Okay. You're getting minty. It's opening up your nose. You're getting refreshing. And you're getting a cooling scent. Okay. Any guess what this could be? Take a guess in 3, 2, 1. Good job. So you said minty. That's correct. This one is eucalyptus. You're doing so good. I'm impressed already. Okay. Keep your eyes closed. You pinky promised, right? Okay. What's this next one? Okay. Oh, this one smells amazing, by the way. Keep your eyes closed. What is this one? Take a guess. Breathe in. Breathe out. Okay, you're getting floral. Like flowers. You're getting herbal. Like a tea. Good. Like a spa. Okay. Any guesses what this could be? Take a guess. 3, 2, 1. So good. Okay. Floral is correct. Did you get lavender? Because that's perfect. Okay. Now just breathe in. Breathe out. Are you ready for the next one? Good. Okay. This one reminds me of my childhood. This one's commonly used as a tea. Keep your eyes closed. Breathe in. Breathe out. What could that be? Okay, you're getting floral. Good. Herbal. That's perfect. You're getting, yes, often used in teas. Okay, take a guess. What is this one? 3, 2, 1. Good job. If you guessed floral, you'd be correct. This one in particular is chamomile. You're doing stupendously, genuinely. Okay? So, we're going to move on to the next one now. A lot of people think this one's very obvious, okay? So, oh, it smells so good. Let's start. Right on your nose now. Keep your eyes closed. Breathe in. Breathe out. Okay. And what's this one? You got this almost immediately. It's citrus. It reminds you of lemon and orange. I don't need to help you with this one. What does this one smell like? Take a guess in 3, 2, 1. Good job. This one was orange. Not surprising you got it so fast. Okay. So, let's try this one now. It might throw you off, but you're doing great. Oh, this one smells better than the other one in my opinion. Keep your eyes closed. Okay. Breathe in. Breathe out. Keep your eyes closed, okay? Good. And what is that? Fabulous. Minty, refreshing, cooling. Opens your nose and your nostrils. Okay, and what is that? You got it immediately. Take a guess. 3, 2, and 1. Good job. That one was mint. In particular, it's peppermint. And as you smelled eucalyptus before, this should have been an easy reminder. You're doing so good. And when you only have a couple left, okay? Do you need to break it all? Okay, just let me know if you do. They're going to get a bit more difficult now, okay? And again, there's no correct answer. We're just looking for notes. Okay. This one's fabulous. What is this next one? Okay. Breathe in. Breathe out. Yes, this one is a bit more difficult. This one smells herbal. Yes, it's often used like that. This one smells like the outdoors, like plants. I would agree. It almost smells like medicine, which is actually accurate. And a bit like, very good, a bit like pepper. Any guesses? Take a guess. 3, 2, and 1. Good. Plant was correct, or outdoors were correct. This one is called vetiver, and it's often used in perfumes and colognes, and it gives it more of an herbal smell without it being too citrusy or too floral. You're doing good. Here's the next one. I love this one. This one's going right under your nose. Breathe in. Breathe out. Good. And what is that one? You got it almost immediately. This one is earthy. It is woody. And it should remind you of a tree. Okay, any guesses? 3, 2, 1. Good. This one actually is a tree. It's called sandalwood. It reminds me of a fireplace. Doesn't that remind you of a fireplace? Great job. And we're on to the last one now. You either get the smell immediately or you don't. And that's because this one is so commonly used in everything. Okay, keep your eyes closed. Oh, I love this one. Okay, keep your eyes closed, okay? It's a bit strong. That's why I use it last, because I don't want it to overwhelm you to begin with. Okay, and breathe in. And breathe out. And what is that? Floral immediately. And almost like soap or hand soap. That's so perfect. What else are you getting? Okay, it's very strong. Okay, I'll move it away from your nose, but keep your eyes closed. What do you think that is? 3, 2, 1. Okay, it's floral, yes. You can open your eyes now. This one is jasmine, and it's a floral soap scent. It's used with perfumes. It's very often used in cleansing products like soaps or lotions. And what it's most popular for is they use it quite frequently in hair oils and hair products. However, because the smell is so strong that they typically use it for perfumes and colognes to bring out a certain scent. It's lovely. You did so good. And how's your nose feeling? Are you feeling okay? Okay. And we're going to move on to the taste test now. Is that okay with you? Good. Okay. So, I'll ask you to close your eyes again. You can wait before I do that. So, I have 2 taste tests here. One of them is sweet, and the other one is sour. I could even give you sweet twice. I could give you sour twice. I could give you sweet and sour, or I can give you sour and sweet. Are you ready to start? Okay. Keep your eyes closed, and I'm going to pick one at random, and I'm just going to tell you to say, ah, taste it, and you let me know if it's sour or sweet. Okay? Let's start. Close your eyes. Keep your eyes closed, okay? Say ah. Okay, and taste that. Okay, and your face did change. Was that sour or was that sweet? That was sour. Okay, good job. Okay, I'm gonna mix it up again. You could get sour or you could get sweet. Perfect. Okay. Keep your eyes closed. Say ah. Good. Okay, and taste that. Was that sour? Or was that sweet? Good, that was sweet. Fabulous. Okay, I'm writing down some results here. Good. Okay, we're going to move on now to your musculatory system and movements. And I'm just going to move your head back and forth and test your ears and your ocular motor function, okay? Good. So, I'm going to get up a little bit close, and I'm going to test your ears first. Let me know, when can you hear the sound start? Good. Let me know again. Good, and what about now? Good. I'm gonna whisper something into your ear. I want you to repeat the word back to me, okay? Let's start on this side. Sleep. 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 Okay. And are you able to repeat the word back to me? Sleep. Very good. And the other ear. Good night. Good night. Good night. Okay. And can you repeat the word back to me? Good night. Do you currently wear a hearing aid or an apparatus to help you hear better? Okay. Do you feel like your hearing has changed within the last 2 months or 2 weeks? Okay. And last question here. Do you feel like your hearing has been sensitive recently? Or do you feel like you're awakened easily at night to noise? Okay. Okay. Now what I'm going to do is I have a tuning fork here. Let me know if you can hear it. I'm going to put it next to your ears. Once more. Could you hear that? Good. Let's raise the tune. Can you hear this? Once more. Could you hear that? Was a bit lighter. And one more. This one should be the most difficult for you to hear, but nevertheless, we're going to test it anyways. Could you hear that? We'll test again. Once more. Was that one a bit more difficult to hear? Okay. Okay, let's now test your musculatory system. I'm going to ask you to change your face into different ways that you can move your eyes, your mouth, your eyebrows, etc. Just follow what I do. Okay. First, I'm going to ask you, can you raise your eyebrows as if you were totally shocked? Good. I'm going to put a bit of pressure on them. Keep them up. Hold your eyebrows up for 5, 4, 3, 2, 1. Good. Relax your eyebrows. Now can you furrow your eyebrows as if you were angry like that? Good. Keep them like that for 5, 4, 3, 2, 1. Good. Relax. Can you lift one eyebrow up at all or attempt to? Okay, relax. Open your eyes really wide as if you were like totally surprised and shocked. Okay, keep them open for 5, 4, 3, 2, 1. Good, relax. Now close your eyes super tight. I'm going to try to open your eyes, so resist me trying to open them, okay? Close your eyes really tight and resist, resist, resist. Okay, good. You can relax your eyes now. You can open them if you like. Good. Okay. I'm going to ask you to smile as best as you can. Give me a very cheesy smile. Good. I'm just going to poke, poke, poke around your face. Poke. Okay, relax. Good. Now give me a very sad frown, as if almost like a cartoon, okay? And I'm gonna poke. Any sensitivity when I poke? Okay. Good. Relax. Okay. Now I want you to raise your shoulders for me like this. And I'm gonna put pressure down on them, and I want you to resist me pushing your shoulders down. Okay. Okay. Lift your shoulders up and resist. 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 And resist. Good. Relax. Okay. Now what I want you to do is shake my hand. We're going to do both hands. And you can squeeze my hand as tight as possible, okay? Just do it for 5 seconds. First hand, and shake. 5, 4, 3, 2, 1. Relax, good. Other hand. 5, 4, 3, 2, 1. And relax, good. I'm going to test your knees now, and I'm going to just tap them and to get the reflex on them. Try not to kick me, okay? Let's try here. Good. Other side. Good. I'm I'm going to test the reflex on your forehead to see if your eyes move. Good, a little below. On the cheek. And above the lip. Okay. Did you feel any pain from that at all when I tested that? No? Good. And we're going to do one last test here. I'm going to ask you to close your eyes for this part. I'm going to give you a sharp or dull test. I have this tool here. One side is a bit sharp and the other side is very dull. All you have to do is let me know which side I'm touching your face with, okay? Good, close your eyes. Sharp or dull? Take a guess. 3, 2, 1. Dull. Good. Keep your eyes closed. Sharp or dull? Take a guess. 3, 2, and 1. Sharp. Twice more sharp or dull. Take a guess. 3, 2, and 1. Good, that is dull. And keep your eyes closed once more, sharp or dull. Okay. Take a guess. 3, 2, and 1. Dull. Okay. You can open your eyes now. Your exam is complete. Thank you for coming on by. Again, I'm Dr. Breen. Looks like we're keeping you here for a sleep study now. And what we're going to do is we're going to have a nurse come in and attach these stickers onto your face and analyze how you sleep. And then in the morning we'll retest for another detailed cranial nerve exam. Does that sound correct? Okay, good. And now that the results are finished, I'm going to process these and then I'll be out of the room. Just give me a couple of minutes to just type on my computer. And I hope you have a great rest of your night. And by morning we will give you the results of today's exam. And in the morning, we'll give you the results of tomorrow's exam, okay? Perfect. Have a great night here at the sleep study, and I hope you enjoyed your extremely detailed cranial nerve exam. Again, I'm Dr. Breen, and I'm just going to finish up writing some notes here, okay? Good. Have a good night, relax, and a nurse will come in and help you just go right on to sleep. Ciao.